This medication is used to treat or prevent certain types of headaches, such as migraine and cluster headaches, which are caused by widened blood vessels in the head. Ergotamine works by narrowing these widened blood vessels, while caffeine helps to increase its absorption and also narrows the blood vessels. It is important to take this medication as directed by your doctor, and the usual dosage is 1 tablet at the onset of a headache, with a maximum of 6 tablets in 24 hours. It is best to take this medication as soon as the headache starts for the best results. When taking Ergotamine-Caffeine, you can take it with or without food as directed by your doctor. Usually, you'll start with 2 tablets at the first sign of a headache, followed by 1 tablet every half hour until the headache is relieved. Just make sure not to take more than 6 tablets per headache attack or 10 tablets in a 7-day period. If your doctor has prescribed this medication to prevent certain types of headaches, like cluster headaches, take it exactly as directed, usually for short-term treatment, 2 to 3 weeks. The dosage will depend on your medical condition and response to treatment. Remember, this medication works best if taken at the first sign of the headache. Waiting until the headache has worsened may make the medication less effective. If your doctor thinks you might have a higher risk for heart problems, they may want to do a heart exam before you start taking this medication. They may also have you take your first dose in the doctor's office to monitor for serious side effects like chest pain. This medication is usually taken only as needed, not for long-term daily use. While Ergotamine-Caffeine helps many people, it can sometimes cause addiction. This risk may be higher if you have a substance use disorder. Take the medication exactly as prescribed to lower the risk of addiction. If you're using drugs for migraine attacks on 10 or more days each month, they may actually make your headaches worse. Don't use medications more often or for longer than directed. Let your doctor know if you need to use this medication more often, if it's not working as well, or if your headaches are getting worse. If you experience nausea, vomiting, upset stomach, restlessness, trouble sleeping, or dizziness, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. Be sure to tell your doctor right away if you experience any serious side effects, such as slow/fast/irregular heartbeat, numbness/tingling in fingers/toes, blue fingers/toes/nails, muscle pain/weakness, severe stomach/abdominal pain, lower back pain, or signs of kidney problems. Seek medical help immediately if you experience very serious side effects, including chest/jaw/left arm pain, confusion, trouble speaking, vision changes, or weakness on one side of the body. While a serious allergic reaction to this drug is rare, seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. This medication can rarely cause a serious decrease in blood flow to the arms, hands, feet, or brain, which could lead to a stroke. The risk of this happening is higher when this medication is taken with other drugs that can affect how your body removes ergotamine. Some examples of these drugs include mifepristone, telithromycin, certain antidepressants, azole antifungals, cobicistat, macrolide antibiotics, HIV protease inhibitors, ritonavir, and SSRIs. Before taking Ergotamine-Caffeine, it's important to let your doctor know if you are allergic to ergotamine, caffeine, or other similar medications. This medication may contain inactive ingredients that can cause allergic reactions, so it's crucial to discuss any allergies with your pharmacist. Before using Ergotamine-Caffeine, share your medical history with your doctor or pharmacist, especially if you have a history of certain types of headaches, heart problems, kidney disease, liver disease, or substance use disorder. Certain conditions such as high blood pressure, high cholesterol, diabetes, being overweight, or having a family history of heart disease can also increase your risk for heart problems while using this medication. It's important to note that ergotamine caffeine can cause dizziness, especially when combined with alcohol or marijuana. It's advised to avoid driving, using machinery, or doing anything that requires alertness until you know how this medication affects you. Limiting alcoholic beverages and discussing marijuana use with your doctor is also recommended, as alcohol may cause headaches. Using tobacco or nicotine products while taking ergotamine caffeine can increase the risk of serious side effects, such as heart problems and decreased blood flow. It's important to avoid using tobacco while on this medication, and if you smoke, talk to your doctor about how to quit. It's crucial to inform your doctor if you are planning to have surgery or certain medical procedures while using ergotamine caffeine. This medication is not safe to use during pregnancy and may harm an unborn baby, so discussing reliable forms of birth control with your doctor is essential. Ergotamine caffeine can also pass into breast milk and have negative effects on a nursing infant, so it's important to consult your doctor before breastfeeding while using this medication. It's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. If you also take triptan migraine drugs, such as sumatriptan or rizatriptan, you will need to separate your triptan dose from your dose of ergotamine caffeine to lessen the chance of serious side effects. Ask your doctor how long you should wait between your doses of these drugs. Some products may contain caffeine or ingredients that could raise your heart rate or blood pressure. This includes certain beverages such as coffee, colas, and energy drinks. Make sure to tell your pharmacist what products you are using and ask how to use them safely, especially cough and cold products, diet aids, or other headache products. It's also important to be aware that this medication may interfere with certain medical and lab tests, potentially causing false results. Make sure that lab personnel and all your doctors know that you use this drug. If someone has taken too much ergotamine caffeine and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of an overdose may include nausea, vomiting, numbness or tingling in the fingers or toes, chest pain, and muscle weakness. It's crucial to follow the recommended dosage and seek medical help if you suspect an overdose. Ergotamine caffeine is used to treat migraines and cluster headaches. It is usually taken at the first sign of a migraine headache. The usual dose is 2 tablets at the start of the headache, followed by 1 tablet every half hour until the headache is relieved, up to a maximum of 6 tablets in one day. It is best to take ergotamine caffeine as soon as you feel a migraine coming on, for the best chance of it working effectively. Always follow the instructions from your healthcare provider for the most effective treatment. It's important not to share this medication with others, as it is specifically prescribed for your condition. Certain foods, drinks, or food additives like red wine, cheese, chocolate, and monosodium glutamate, as well as lifestyle patterns such as irregular eating or sleeping habits and stress, can trigger migraine headaches. Avoiding these triggers may help reduce the frequency of migraine attacks. It's best to consult your doctor for more detailed information on managing these triggers. As for the daily dosage and timing of taking ergotamine caffeine, it is important to follow your doctor's instructions. The usual dosage is 2 tablets at the first sign of a migraine, with an additional tablet every 30 minutes if needed, up to a maximum of 6 tablets in 24 hours. It's best to take the medication as soon as you feel the onset of a migraine. Always consult your doctor for the best timing to take this medication based on your individual condition. Ergotamine caffeine is used to treat migraines. It helps to relieve headache, pain, and other symptoms of migraines, including sensitivity to light and sound. This medication is usually used at the first sign of a migraine headache. If you have nausea, vomiting, or a headache that is different from your usual migraines, consult your doctor before using this medication. Take this medication by mouth with or without food as directed by your doctor, usually at the first sign of a migraine. If there is no improvement in your symptoms, do not take more doses of this medication before consulting your doctor. If your symptoms are only partly relieved, or if your headache comes back, you may take another dose at least 2 hours after the first dose. Do not take more than 6 tablets in a day. If you have a higher risk for heart problems, consult your doctor about the safety of using this medication. The best time to take this medication is at the first sign of a migraine. Make sure to store ergotamine-caffeine at room temperature, away from light and moisture, and keep it out of the bathroom. Keep all medications out of reach of children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.